In this video, we demonstrate a height-preserving sizing method for the new Artisse 2.0 device. This manual technique can be used as an interim solution when treating aneurysms that do not fit the standard sizing chart or when the sim and size software is unavailable. For operators already familiar with web device, this intuitive approach will feel comfortably familiar. We've designed the sizing method using similar principles, allowing experienced web users to adapt effortlessly to the new system. When we compare an Artisse to a web device with the exact same width and height, the Artisse actually has a smaller total volume. This is due to its unique flared design. The device is tallest at the center, with gently tapered edges that create shorter sidewalls, making it ideal for spherical or ovoid aneurysms. The middle body segment represents the widest part of the device, which bears the highest compressive forces during lateral compression and plays a vital role in stabilizing the device. Unlike the web, which maintains its cylindrical form after vertical elongation, the softer dome and base of the Artisse undergo significant vertical extension during deployment, while the body segment remains relatively unchanged in height. This unique behavior results in lower radial forces in the device's dome and base, which facilitates safe deployment of the implant and can be simulated using the sim and size software. Therefore, the key to enhanced device stability lies in preserving the proportion of the body segment, and this starts with maintaining the Artisse's natural height. Let's examine two examples in a 6mm flow model, a 7x5 versus an 8x4mm device. While the 8x4 undergoes greater lateral compression, its shorter body segment actually reduces overall stability. As a result, sacrificing height for excessive lateral compression can potentially lead to worse treatment outcomes. As showed in our flow model demonstration, the 7x5 device maintains its optimal flared profile, while the 8x4 forms a more spherical shape due to a shorter middle body segment. When we place both Artisse devices in a 6mm flow model and apply forward pressure, the results are striking. The 7x5 maintains its flared shape, advancing smoothly with stable movement. In contrast, the 8x4 struggles, lacking stability. It begins to rotate unevenly until one side collapses against the tube wall, and the base of the device forms a signature comet tail configuration. That's why maintaining the device's natural height is critical, which increases the proportion of the body segment and ensures a stable, secured implant. Now, take a look at this elongated PCOM aneurysm case. We deployed an 8x3 Artisse device. Pay close attention to how the dome moves independently from the distal marker during forward pressure on the pusher wire. This motion indicates partial device rotation, further evidenced by the distinctive comet tail appearance of the device base. In another elongated PCOM aneurysm, we deployed an 8x5 Artisse device. Notice how the increased height greatly enhances device stability. The implant maintains its position with only minimal base flattening, despite applied forward pressure. These findings suggest that preserving the device's natural height is fundamental to achieving optimal performance. Based on the early experience, we propose a sizing strategy that tailors to the aneurysm's specific shape. For spherical or ovoid aneurysms, the traditional +1-1 approach for the web works effectively because the device's natural shape closely matches these anatomies. However, for cylindrical aneurysms, we suggest a +1-0 strategy, matching the device's height to the aneurysm to ensure proper sidewall coverage and prevent dog ear formation at the neck. This approach intentionally allows the V-shaped base to descend slightly into the parent vessel. Always make sure there is enough space to accommodate this protrusion, and consider preemptive short-term antiplatelet cover if significant base protrusion occurs. Here are some cases where the sizing strategies were successfully applied to achieve complete neck coverage of the aneurysms, while allowing safe, controlled descent of the device's base into the parent vessels. Both patients were discharged on short-term single antiplatelet therapy with no reported thromboembolic complications. Keep in mind that the sizing strategies we proposed are based on preliminary data from a limited sample. Further validation with more clinical data is required to confirm these findings.